I think palliative care truly needs a reshaping of its image. The society and even the healthcare professionals need to view palliative care as humanistic care. Yes, it is important, especially in patients facing severe and critical illnesses, but the same approach should be made available to all patients who are suffering from pain and discomfort of different degrees. It can be initiated by any particular individual of the healthcare team to different levels of sophistication. What we need is an integrated network whereby everyone is trained in some form of fundamental palliative or supportive care. And then we call in the specialist palliative care services when the situation turns more complicated and sophisticated. I started off in medical school thinking that I want to be a cardiologist, a doctor that saves lives, prolong life. And when I went into housemanship, which is the first year as a junior doctor, reality sort of set in. I realized that being a doctor is very different from what I envisioned. Patients in the wards often experiences a lot of physical discomfort, such as pain and breathlessness, emotional distress from anxiety, from feelings of meaninglessness and helplessness. And oftentimes, family members, especially in the setting of critical illnesses, they are at a loss of what to do, they can't plot the path ahead, and there's a lot of uncertainties. And it is then that I realized having the most advanced technology, having the best drugs available, while important, may not solve the underlying human issues that we see in the ward. And it is fortunate that I met with very inspiring seniors in the lines of geriatrics and palliative care. And these mentors showed me what humanistic care is about. It's about connecting with our patients, with their family members on a person-to-person level, and trying to assuage their discomfort, their suffering, and to bring clarity to a very complex situation, and to support them along a journey where they themselves may not know where it will end. Palliative care is a very emotionally invested discipline. In order for palliative care physician and the whole multidisciplinary team be able to do palliative care, there needs to be a certain strength in heart, openness of mind, to be able to then bring together a sense of clarity, a sense of comfort, to support the family members and the patients through a difficult journey, in a sense carrying that burden of suffering with them.